The delayed complications of chemical peels are somewhat more serious than the ones we spoke about in our previous video. These show up a few days to a few weeks after your chemical peel was applied and usually need treatment to get better. So let's talk about what these delayed complications are and what you can do about them. Now the first one is hyperpigmentation. Hyperpigmentation is the darkening of the skin. It's a common side effect of chemical peels that use TCA or trichloroacetic acid. If not properly treated, it can be persistent. Any treatments for hyperpigmentation after a chemical peel will need to be prescribed by your doctor to be safe and effective, but they may include the use of sunscreen with an SPF of 30 or higher, retinoic acid 0.05% cream in combination with 4% hydroquinone, which can be used once or twice daily for 3 weeks or longer if necessary, and hydrocortisone cream, which can be used for several weeks as needed if redness from irritation due to retinoic acid occurs. There are also a few things that you can do to try to avoid and prevent hyperpigmentation when getting a chemical peel done. These may include having a good and suitable skincare regimen, which helps the effects of the peel to last longer and prevent hyperpigmentation. You can try to avoid sun exposure and always use a broad spectrum sunscreen before and after your peel. And when doing superficial peels, start at a low strength and increase only if necessary. Temporarily stop the use of birth control pills before your chemical procedure and after to prevent hormonal stimulation of your melanocytes. The second one is hypopigmentation. This is the opposite of hyperpigmentation, and it means that there will be patches of skin that seem bleached and thinner, almost like vitiligo. More extensive hypopigmentation can occur with medium and deep peels. This is because of the deeper penetration into the skin, so deeper layers will be affected and more melanin will be removed. Now, there is no specific way to prevent hypopigmentation. However, after your skin has healed from the peel, the surrounding area can be treated. With time, your skin can eventually regain its color, or with professional guidance, you can use a skin lightening agent to make the spots of hypopigmentation less obvious by gradually lightening the surrounding area. The third one is wrinkles. Please keep in mind that chemical peels are not expected to completely get rid of your wrinkles and fine lines, especially not after one treatment. However, they are expected to make them less apparent. But the opposite may occur in people with darker skin tones who have undergone medium and deep peels. The lines in the skin may become more obvious. This can be prevented by using the feathering technique on the edges and by using a lower concentration when applying the peeling solution so that the area can merge with the surrounding skin. To treat wrinkles, you can use retinoids, dermabrasion, laser treatments, or microneedling after your skin has completely healed. Fourth, we have breakouts. Now these are usually called milia, which are tiny white bumps that look like cysts or pimples that can break out on your face or any other part of your body. They are not all that common after chemical peels, but they can occur during the first weeks of the healing period. Usually people with thicker skin are more at risk since the major cause of milia is occlusion or the blocking of your pores. To prevent breakouts, you can stick to more gentle and superficial procedures of exfoliation, or you can ask your doctor about using tretinoin before and after your chemical peel. In regards to treatment, breakouts usually resolve on their own. However, in some cases, gentle and sterile extraction may be necessary, which means popping of the pimples using sterile tools, and you may need some antibacterial and anti-inflammatory creams and ointments. Fifth, we have allergic reactions and persistent irritation. This usually comes in the form of dermatitis. Allergic dermatitis is most likely to occur with peels like resorcinol, salicylic acid, etc. On the other hand, irritant contact dermatitis mostly occurs with glycolic acid, but it can be caused by any peel that is used too often or in too high concentrations, or with improper skin preparation. Both forms of dermatitis can be recognized by itching, swelling, blistering, hive-like breakouts, pain, burning, or stinging in the skin. Depending on the severity of your allergic reaction, your doctor will recommend topical steroids such as hydrocortisone to reduce inflammation. If the reaction is very bad, they may also prescribe oral medication for you to take. Do not try to treat your allergic reactions at home or by yourself. This can make your reaction worse and may result in permanent skin damage. And finally, the most serious one, chemical burns. A chemical burn will destroy one or more layers of your skin. You may experience redness, irritation, pain, numbness, or burning at the site of contact. Severe symptoms include the formation of blisters or black dead skin at the contact site, vision changes if the chemical gets into your eyes, or even coughing and shortness of breath if strong fumes are inhaled. A chemical burn can result from using a chemical peeling solution that is too strong or unsuitable for your skin, leaving the solution on your skin too long, prepping your skin before the chemical peel too aggressively, or not having a proper skincare and sun protection routine before your chemical peel. Depending on the severity of the burn, you may need first aid and intense medical treatment. Chemical burns should not be treated by yourself. Our next video will talk more about chemical burns from chemical peels and exactly how you can treat them, so check that one out. Here at Sassily Skin, we do our best to help you understand and take care of your skin. Help us to keep helping you by subscribing and hitting that notification bell. And remember that happiness is a habit, just like skincare.